Welcome to Invest Insights. I'm Abby Maloney. I'm joined today by Anita Bachmann, the CEO of UnitedHealthcare's Community Health Plans of North Carolina. She joins us for our discussion on the COVID-19 pandemic. Don't forget to like this video and subscribe to our channel for more insights like this. Anita, since the advent of COVID-19, UnitedHealthcare has provided $70 million to the global community. Tell us exactly how that translates to North Carolina.
Thank you, Abby, for the chance to just share more information about UnitedHealthcare's commitment, not only to the entire country, but specifically to North Carolina. As you mentioned, over $70 million that we've invested across the country, and very specifically in North Carolina, several $million that we've invested to really focus on, I think, most immediately the needs that we're seeing as a result of COVID. So we know that food insecurity has been a big issue in North Carolina for a long, long time. And I think COVID has certainly exacerbated that food insecurity issue. And so a commitment that we've made through dollars that we've invested in community organization, Meals on Wheels, Second Harvest Food Bank to ensure good, healthy foods are getting out in the communities. As well, one of our offices, largest office in North Carolina, is based in Greensboro. We have 2,500 employees in this building, and with 99+% of them working from home, we had a cafeteria that would normally feed our employees. So we pivoted, and now that cafeteria is preparing healthy foods every single day, and we're feeding the community. So we provided over 48,000 meals already in the community, and are continuing that about 6,000 meals a day. So that certainly is one area. PPE we know is a big issue, and so a huge investment we've made in providing cloth masks, hand sanitizer, even things like diapers and formula that are just in great need right now that people just aren't able to access, get to the grocery store to get. So any and all ways that we can support not only organizations but individuals during this time is what we have really been focused on.
As the CEO of North Carolina's UnitedHealthcare Community Plans, how would you say that these efforts have benefited your state's Medicaid population?
I think all of our hope is that all of our efforts are meeting the needs of the entire population of North Carolina. So not necessarily focused on any particular population, but really all individuals who need it, and particularly those that are most vulnerable are ones that we hope we've been able to help in a very, very meaningful way, either individually and directly or through the community-based organizations that we partnered with.
What other services has UnitedHealthcare extended to help your members through this pandemic?
So several things in particular. So to benefit the community at large, during this time, people are fearful. There's a high level of anxiety and fear. People have lost their jobs. People have been furloughed. People aren't really sure if they're going to be able to get to the grocery store and when to get the meals that they need. So we've made available an emotional support line. It's available to any and everyone in North Carolina, across the country, staff with professionals, really to talk to people and to help answer questions and hopefully to reduce their anxiety and help them get the care and the services that they need. Another thing that we've done, again, available to everyone, is what we call a COVID symptom checker. And so we know many people, don't want to leave their homes for fear of being exposed unnecessarily, but they're also wanting to know if they have symptoms that might be indicative of COVID. So it's a symptom checker that's available online on your phone, and it asks a series of questions, and then based on the answers to those questions, it helps you determine what you should do next. Should you stay at home? Should you call your primary care physician? Should you go to the emergency room? So there have been a couple of ways that we've offered services, again, to everyone. And then our members. So we currently serve over 1.4 million North Carolinians across the state of North Carolina today. And how we are working with and supporting them. One is telehealth, virtual visits. That capability has been around for a number of years now, but we've not really seen the use of that. I think some people aren't comfortable using it. Maybe they don't trust it. And so we've really supported our members in strongly encouraging them, one, how to use it and to feel confident in the confidentiality of it. And so we've also waived cost sharing and copays so that they don't have any financial responsibility in using those services. We have seen over the last several months the use of virtual health double. So we're very pleased and really excited and hope that that will continue. Other things that we have done, our employers right now certainly are concerned given the number, we've seen the high rise in unemployment, financial difficulties and concerns. And so we've offered a grace period, not only for individuals, but for our employer groups who need that grace period and in paying their premiums. Again, we want to do everything we can to just kind of ease the burden and help address some of the needs that we see and that we're aware of most immediately.
Are there anything else that you're doing to help rein in the cost of healthcare?
Yeah, it's really interesting. I think we're all seeing that people have been very, very reluctant, Abby, to go to the doctor's office again or even to the hospital. And so, I think we've all seen, and even hospitals are reporting less utilization than probably ever before. I think as things begin to get to what I'll call a new normal, people will begin to seek services again. And obviously, when we continue doing what we're doing right now, working with and partnering with providers, with hospitals, with individuals on how to take better care of themselves, really to manage the cost of healthcare. Part of that is really prevention and getting services when they're most needed, and then continuing the partnerships that we have with providers, sharing data around driving and achieving better quality care. So those things will continue post-COVID as we have been doing prior to COVID.
Outside of the pandemic, how does North Carolina Medicaid compare to national health outcomes and costs?
Yeah, it's a really good question. Currently, the Medicaid program in North Carolina is a fee-for-service program. And, legislation was passed several years ago to transition from a fee-for-service to more of a managed care program. And so right now we look forward to when that program is launched. It was originally to launch in November, and that date got moved to February. And certainly as a result of COVID, we don't have yet a date for that, but we continue to work with the Department of Health and Human Services on when that new date will be. And again, we look forward to really partnering with the state, partnering with providers to really help achieve, I'd say, better and more budget predictability for the Medicaid population. And then I think in a very meaningful way, address some of the needs that vulnerable population has that really attribute and contribute to their health. And they're things like what we call social determinants of health, really working with those individuals to address, providing transportation, helping them get a job, ensuring that they've got access to a physician, ensuring that they've got access to good, healthy foods, all those things that play such an important role in achieving better health. So again, we look forward to that day and hope that that day is very, very soon to come.
And is there anything else that you'd like to share with us from UnitedHealthcare North Carolina?
We again are so pleased to be a large employer in North Carolina. We have over 5,000 employees who live in North Carolina, work in North Carolina. We have the privilege of serving over 1.4 million individuals in the state. And again, for us, it's important that we do everything we can to support the state, support individuals, not only through COVID, but if there is a post-COVID or what we call a new normal. So again, we look forward to continuing to play a very, very important role in partnering and collaborating across the state.
Wonderful. And Anita, should our viewers want to find out more information about UnitedHealthcare of North Carolina, where would you direct them?
Absolutely. Yes. So UnitedHealthcare.com is the best site to go to. It'll provide just a tremendous amount of information about our company nationally, but also all the specifics about the programs, the products, the benefits that we offer here in North Carolina.
Fabulous. Well, thank you again. That was Anita Bachmann, the CEO of UnitedHealthcare's Community Health Plans of North Carolina. Don't forget to like this video and subscribe to our channel to watch more insights like these. My name is Abby Maloney, and you've been watching Invest Insights.